to those of you that have joined our call tonight. Even though we are still dialing people, we're going to go ahead and get started. I'm Greg Thompson, Executive Director of the Personal Assistance Services Council, and I would like to thank you for being on our call tonight. Tonight we will continue our series of discussions on Cal MediConnect. Wait, don't hang up. We have a very special call plan for you tonight. It is what you have all been waiting for. We have all 5 health plans for Cal MediConnect on the line with us tonight, and you will be able to call in and ask questions. We have a representative from LA Care, HealthNet, Molina, CareMore, and Care First. Who will be on the call tonight, and I really hope you'll stay with us throughout the call. I think most of you have heard of the Affordable Care Act, which created the Coordinated Care Initiative, whereas the state Medi-Cal program and the federal Medicare program have partnered to start a new project to improve care for California's seniors and people with disabilities who are dually eligible for both of the public health insurance programs, or dual eligible. Basically, if you have Medicare and Medi-Cal, you are considered a dual eligible. Cal MediConnect is the name of the program, where all of the beneficiaries, medical, behavioral health, long-term institutional, and home and community-based services, or IHSS, will be combined into a single health plan. This will allow your providers to better coordinate your care and make it simpler for you to get the right care at the right time in the right place. Now to begin, it's my pleasure to welcome Gretchen Brown from LA Care. Welcome, Gretchen. Thanks for being on our call.
Well, thank you, Greg, and good evening, everybody. I'm happy to be here. As Greg said, my name is Gretchen Brown, and I'm the Senior Director of Medicare at LA Care Health Plan. We really appreciate the opportunity to participate in this teletown hall meeting tonight, and of course, LA Care appreciates also the opportunity to participate in the Cal MediConnect program in LA County. We really see the Cal MediConnect program as an important chance to help redesign and improve the healthcare delivery system for individuals who are dually eligible for Medicare and Medi-Cal, to help reduce some of the fragmentation that's resulted over the many years of these programs operating under different and very various and multiple funding sources for both the health, medical, and for the social service components of the services that dual eligibles use. We also think that Cal MediConnect is a great opportunity to improve care coordination for people who are dually eligible for Medicare and Medi-Cal, and to really help support them in staying healthy and living safely in their homes and the communities. LA Care is really committed to the program and to the beneficiaries we serve. As you probably know, LA Care is a large public health plan. We serve over 1.4 million low-income individuals who reside throughout LA County, and we've been in operation since 1997. Today, we're serving about 4,500 Cal MediConnect members through what we would consider a really high quality and attractive network of physicians, specialists, behavioral health providers, pharmacies, other healthcare providers, our contracted medical groups, virtually all the hospitals in LA County, a number of home and community-based services and nursing facilities. Greg wanted me to give a little he's already given a little detail about the Cal MediConnect program, but he also asked me to provide sort of a general overview, and then some of my colleagues from the other health plans are going to go into more detail about certain components of the program. So just to sort of back up, as you probably know, California's Coordinated Care Initiative, which kind of goes by the letters CCI, was passed by the state legislature in 2012. And like I said, the goal of the CCI was to improve how the state delivers healthcare services to individuals who are seniors 65 or over, or individuals who are living with disabilities. There are basically two parts of the CCI. The first part, which we're really not focusing on as much tonight as the second part, but the first part is called Managed Long-Term Services and Supports, or MLTSS. And that is mandatory for all Medi-Cal beneficiaries in LA County. And essentially, what the state is doing under that part of the Coordinated Care Initiative is they're basically moving the Medi-Cal wraparound and the long-term care services and supports benefits that have all historically been under the Medi-Cal fee-for-service benefit into the county's Medi-Cal managed care plans, LA Care or HealthNet. The second part of the Coordinated Care Initiative, or CCI, and the part that we're really focusing on tonight is Cal MediConnect, which also goes by the acronym, I guess is it an acronym? CMC, but Cal MediConnect is the actual name. It's a 3-year demonstration in which individuals who are dually eligible for both Medicare and Medi-Cal can choose, because Cal MediConnect is voluntary, they can choose to enroll, if they would like, into one single coordinated health plan to receive all of their Medicare and Medi-Cal benefits. That means all benefits like physician, hospital, lab, prescription drugs, behavioral health, medical equipment and supplies, skilled nursing, long-term care services like IHSS, CBAS, MSSP, are all provided by one single plan, like the 5 plans that are on the phone tonight, using one ID card, which each plan has, and one telephone number, the member services number for each of the plans, and where individual beneficiaries can call in for help or support, and also providing coordination with for the members and with the members between their physicians and other providers and care management services. There are also some additional supplemental benefits that are available through Cal MediConnect: vision, dental, transportation, and care plan options. So Cal MediConnect is interesting. Like I said, it's a demonstration. It's a great opportunity for Los Angeles County to, really come together and work to develop a new type of delivery system. Granted, there are significant kinks that need to be worked out, but it's a great opportunity for us, and it's a joint effort between the state Medi-Cal program and the federal government, the Medicare program, to promote coordinated healthcare delivery to individuals who are dually eligible for both Medicare and Medi-Cal. Just sort of briefly, some of the overall goals of the Cal MediConnect program are, on a global level, to provide a coordinated healthcare system that will provide better care, improve health outcomes for those individuals who choose to enroll in it. And some of the the more specific goals of the Cal MediConnect program are obviously, to improve quality of care for beneficiaries, to maximize the ability of beneficiaries to remain living safely in their homes and the community with the appropriate services and supports that they need to do so, to definitely coordinate Medi-Cal and Medicare benefits across various healthcare settings, and to help improve continuity of care across physician, hospital, long-term care, and all those other services that are provided under Medicare and Medi-Cal. And then to promote a system that's sustainable and that's person and family centered and helps beneficiaries, attain and maintain their own health goals through, partnerships with their providers, with their health plans, and helping them through providing them coordinated healthcare services and community resources that they need in order to, remain living healthy and safe in the community. Just briefly, and then I'll close. Excuse me, my lights just went out. Cal MediConnect started in LA County in April of this year. There was a couple of months of voluntary enrollment, and Dan from CareMore is going to go into more detail about the eligibility and the enrollment processes for Cal MediConnect. Cal MediConnect operates in a couple of other counties other than LA County: San Bernardino, San Diego, Riverside, and San Mateo are the other counties in addition to LA. And then, like I said earlier, in LA County, Cal MediConnect operates through the 5 plans that are on the call tonight: LA Care, Care More, Care First, Molina, and HealthNet. So I do appreciate this opportunity, and like I said, wraps up what I was going to say, and I'll turn it back over to Greg or Dan at CareMore to continue.
Thank you, Gretchen. Thank you very much for being here tonight, and we appreciate your overview. For those of you that might have just joined us, we're talking about the Cal MediConnect program. Now I would like to introduce our second presenter, and that's Dan Salo from CareMore, who's going to talk to us a little bit about eligibility and enrollment. How are you, Dan?
Very good, Greg, and thank you again for this opportunity to talk with you and your guests. What I'm first going to do is the whole discussion about eligibility and enrollment process is a little difficult, so I'm going to try and keep it as simple as possible, and I'll try and speak slowly. But the first thing I'm going to ask your guests to do is to get a pen and a piece of paper, because I want to give you a couple of very important phone numbers. For those of you that want to get more information and possibly set up a counseling appointment, as Greg mentioned before, you should contact the Center for Healthcare Rights. And I'm going to give you that number again because it's very important. 1-800-824-0780. There's another number I want to share with you as well, and this is the number for the state broker. These are folks that you would contact if you choose to enroll over the telephone. And they're called Healthcare Options is the name of that organization. And their phone number is 1-844-580-7272. And those are the people that you would call if you had questions about your eligibility, if you wanted to enroll, or if you wanted to opt out of the Cal MediConnect program. So I'm going to start off by giving you a basic general overview with the warning that there are several exceptions to the program. And so what I'm going to share with you today probably fits the needs of most people that we're speaking with. But if you have very individual questions, I would encourage you to call Center for Healthcare Rights to talk about your individual situation. If you currently belong to a health plan, I would also encourage you to contact them to discuss your situation, because you may have a little different set of circumstances. In general, eligibility to participate in Cal MediConnect, you must be 21 years of age and over and qualify for both Medicare and full Medi-Cal. The majority of people that meet these requirements can choose to voluntarily enroll in the Cal MediConnect plan at any time. If you have any questions about your eligibility, again, you can contact Healthcare Options at 844-580-7272. When we talk about enrollment, the choice is really yours, and you do have a lot of options. The rest of what I'm going to share with you really pertains to those of you who belong to what we describe as original Medicare. Those are folks that do not belong to a managed care plan to get their Medicare services, and you probably only show your red, white, and blue Medicare card and probably your blue and white Medi-Cal card when you go in to see your doctor. And those are the only real two cards that you carry for your services. Those of you with original Medicare, you can join now, or you can wait until the month before your birthday to make a choice. That means if your birthday is in December, you will have up until the end of November to contact Healthcare Options or mail in your choice card. If your birthday is not until April 2015, you can wait clear until March of 2015 before you're going to be asked to make a choice. So depending on your birth date may translate into how urgent you need to make a decision. To enroll into Healthcare Options, to enroll now, all you need to do is call Healthcare Options, or you can fill out the choice form that will be mailed to you 60 days before the month of your birthday. 60 days before your birthday, the state's going to send you what's called a blue envelope form. And in that blue envelope is a letter, a handbook that describes the program and the options, as well as the choice form that I referenced. You are going to be asked to make a choice on that document and or call healthcare options in order to verbally select your choice. But let me walk through the three choices you're going to have. Option 1, do nothing. If you do nothing, you will be automatically enrolled into a Cal MediConnect plan that best matches the doctors you have seen in the last 12 months. May not include all of your doctors, but the state has tried to match you up based on your current physician care history with the plan that best reflects the doctors that you're seeing today. In that letter, the state will tell you which plan they believe best meets your needs. If you haven't seen a doctor in a while, the state is still going to try and pick a plan for you to make sure that you do have health care the first day of the month of your birthday. Option 2, you can choose a different Cal MediConnect plan or a PACE program by filling out the choice form or calling healthcare options. So you don't necessarily have to take the plan that the state has recommended, but you can choose another one. Option 3, you can opt out of Cal MediConnect. Keep your Medicare the way it is today. Continue to do things on your own. You will still, however, as Gretchen mentioned, you will still need to fill out the choice form and call healthcare options because you are going to be asked to pick up a separate plan for your Medi-Cal coverage, and that would be a separate Medi-Cal managed long-term services and supports plan. So you do have the opportunity to keep Medicare with original Medicare, but again, you will be asked to select what we call an MLTSS plan. So again, you've got three options: do nothing, choose a different Medi-Cal Connect plan or PACE program, or call them to opt out. Now, 30 days before your birthday, I'll let you know that you're going to get a little reminder message, and they're going to say you've got 30 days left to make a decision. And the health plan that was recommended to you will also send you a lot of member materials so that you have as much information as possible to make a good decision. They'll also send you an ID card so that if you fail to meet the deadline, you at least will have health care coverage that first day of the month. So there's no chance that you're going to be without health care, and that's very important to the program, and it's very important to us. What happens if you do forget to make a decision or you have a tough time making a decision? No problem, because you can disenroll from Cal MediConnect at any time. So if you do nothing and you find yourself with one of the health plans, that's perfectly fine because you can also disenroll at another time. And I think our friend from Molina is going to talk to you about something unique for Cal MediConnect, and that's continuity of care, because you actually have a way in order to potentially continue to see doctors that you're seeing today by requesting something about a continuity of care, and our friends at Molina will explain that in more detail.
Dan, I'm sorry to cut you off, but in the interest of time, we need to get to the other callers, and then maybe we can come back to you with questions. Thank you very much. That was a good explanation of a very confusing enrollment process. But before we go to our next person, we're going to do our poll question. But before we set that up, I'd like to remind you that if you'd like to ask a question of Dan or Gretchen or any of the other participants, press *3 on your telephone. All right, here we go with the first poll question. When is a good time to call you to participate in a teletown hall? Press 1, Saturday morning. Press 2, Wednesday evening. Press 3, Thursday morning. Let me repeat the question. When is a good time to call you to participate in a teletown hall? Press 1 for Saturday morning. Press 2 for Wednesday evening. Press 3 for Thursday mid-morning. And again, *3 if you would like to ask a question. Julie, are you ready to take a couple of live questions?
Yes, we're going to go with Sharon. Sharon, do you have a question? Yes, I was wondering what would be the best Medi-Cal to choose to keep my IHSS?
That's a great question. Dan, are you still on the phone?
I am. The great thing about IHSS is covered from all the Cal MediConnect plans. You do not, your IHSS is not in jeopardy. Any plan that you join will still continue to support the IHSS program.
Thank you, Dan. Let's take another question, Julie.
Beth, you have a question? Beth?
Hi, is Beth
Hello?
on the line? Hi, Beth.
Hi.
You have a question?
You want to know what my question is?
Yes,
Yes.
please.
Okay. I already have HealthNet. My question is, do they automatically put me on Cal MediConnect or in HealthNet, or do I have to give my consent for them to do so?
Martha, I think that's for you.
Hi, Beth. Thank you for your question. So, if I could just, can I ask a follow-up question? I just want to
Sure.
understand. Okay. So, you're enrolled with HealthNet today for your Medi-Cal benefits. Is that correct?
Medicare, Medi-Cal.
Medicare and Medi-Cal. Okay. So, if you're already enrolled with HealthNet, you don't need to make any changes. You are automatically part of the HealthNet program going forward.
Okay, so I already have it. Even my birthday was Sunday, so I already have it. I don't have to worry about looking for the blue envelope or anything like that.
Yeah. How long have you been a HealthNet member?
Since January.
Since January.
I was with CareMore, and they discontinued covering my area.
Oh, I see.
It sounds like she'll crosswalk over in January.
Yeah. So you, and you're still a HealthNet member for both Medicare and Medi-Cal. So I think what's happening is that you're our member through our Medicare program, our Medicare Advantage program. So what will happen is that you should start seeing information come to your home in the next 30 days to share with you how you're going to automatically be enrolled in Cal MediConnect through HealthNet. So you'll continue to be a HealthNet member. Nothing will get disrupted. They'll just send you information about how going forward, starting January of 2015, you'll become part of the HealthNet Cal MediConnect program.
Thank you, Beth. That's a great question. Julie, do you have anybody else in the queue?
Dane? Dane, do you
Yes.
have a question?
I'm here.
Hi,
I'm here.
Okay.
Dane, ask your question.
Will there be any change in the way IHSS works?
Hi,
That's
Dane.
a great question. Anybody want to take that?
Yeah.
I can take it. This is Lisa with Molina. No, Dane, there will be no change in how your IHSS works. The hours are still determined by the county. The health plans do not have the right to decrease any hours. It is still determined by the assessment that the county does with you. You will have an option of talking with a case manager with your health plan about your IHSS. If you feel that you need some additional hours, your health plan case management can act as an advocate for you, and we can work with the county to see if that is appropriate. So, but nothing should change. It would stay the same.
Thank you, Lisa. Again, and we're going to come back to more questions, so if you have a live question, press *3 on your phone. Now, I would like to introduce our next panelist from Care First. We have Eddie. I'm going to let you give us your title, and then after that, talk to us a little bit about the benefits that are covered and how that works in Cal MediConnect.
Great. Hi. Thank you, Greg, and thanks for having me here. Definitely appreciate the opportunity to share very important information to the people that you guys serve. So you wanted me to give a little bit overview about Cal MediConnect and some of the benefits. I'm just going to go ahead and reiterate a little bit of the specifics of how one qualifies. I think it's been mentioned previously by some of the other colleagues here. So in order to join a Cal MediConnect plan, you definitely have to have both Medicare Parts A, B, and D, and also have what's considered full Medi-Cal. If you have those two components, you will be able to join a Cal MediConnect plan. Now, in regards to the benefits that a Cal MediConnect plan offers, they're going to offer you the same exact benefits that Medicare would offer you and the same exact benefits that Medi-Cal would offer you. The biggest difference now is that you're getting these benefits combined together into one health plan. The way the current system works right now, if there is any benefit covered by Medicare only, the beneficiary would have to navigate and assure that Medicare cover those benefits. And if there's a benefit that's being covered only by Medi-Cal, then the beneficiary will have to also navigate and assure that whether it's a fee-for-service model or already a managed care plan, that they would have to make sure that that coverage gets done through those sources. Cal MediConnect plans will give you that one number to get all your healthcare needs, and all the health plans provide all these benefits. Now, there are a couple additional benefits that come with Cal MediConnect. You will also receive a vision benefit. A vision benefit which will cover you one routine exam annually and $100 for eyeglasses/contacts every 2 years. Another benefit that comes for Cal MediConnect members is a transportation benefit. You will also receive 30 one-way trips per year in addition to any current existing transportation benefit that the beneficiary may have. Cal MediConnect will also involve dental benefits, and each Cal MediConnect plan may be doing it a little bit differently. What happened with dental earlier this year, it was reactivated for adults 21 and over as of May of 2014, and reactivated meaning that now adults over 21 and over can now receive dental benefits through their Medi-Cal. Now, as a Cal MediConnect beneficiary, some of the health plans will also refer you to Denti-Cal to receive those benefits, or some of the health plans may have already also contracted with a dental plan. But the option does come back to the beneficiary, and there are dental benefits allowable now for the beneficiaries. The other advantage of Cal MediConnect, and I think some of my other colleagues are going to talk about it, is regarding the care coordination. So care coordination, we're talking about everybody specifically in the team that will be developed for the beneficiary to assure that they are receiving all the benefits necessary.
Andy, we do have somebody that's going to talk about care coordination, so I'm going to steer you away from that and ask you a question. We've been getting a lot of information from people that are having problems with their pharmaceuticals. They're going to the pharmacy and they're finding out Medi-Cal may or may not cover it. Do you have any tips for them on that?
Yeah, definitely. I think what's happening in regards to some of the issues that we're receiving for their pharmacy benefit, if the beneficiaries are not making a decision, they're passively being enrolled into a Cal MediConnect plan. And by being passively enrolled, they may also automatically be losing their prescription D benefit that they may have had through another carrier. So I think the important thing to do is to definitely try to assure that if they are opting out, they will also need to try to reactivate their pharmacy benefit. And they can do that by calling 1-800-MEDICARE for that as well. So I think that's where some of the folks are kind of being lost in the shuffle. If they're not making a decision, then then they may be losing that carrier that they had previously.
So if I'm choosing to keep my Medicare and I want to join a health plan, would it be a good idea to call that health plan and see if their Medi-Cal covers my current pharmacy needs?
Your pharmacy needs are going to be primarily covered through your Medicare. And then traditionally right now, most folks have to choose a prescription D carrier. So I would suggest that if they already have a prescription D carrier, that they need to contact that carrier to assure that they're going to transition back to them and continue to get the benefits of their prescription.
You know, Greg, this is Gretchen from LA Care. I'd like to add on to that too. I think your point about encouraging beneficiaries to maybe, if they're thinking of enrolling in Cal MediConnect and choosing one of the health plans, to call that health plan's member services department and talk a little bit with their staff about which pharmacies they do cover too in their network. And then another good source of information that I know I rely on for my own parents and tell people about all the time is, of course, HICAP, or the Center for Healthcare Rights at 213-383-4519. That's a great resource too, to get a little more information about your pharmacy benefits and making sure everything's okay with them.
Yeah,
Thank
and
you.
Greg, hi. Greg, this is Martha from HealthNet. I just wanted to add one simple tidbit that may help you all as you're making decisions about which Cal MediConnect plan to pick. Every Cal MediConnect plan has comprehensive pharmacy benefits. So as you're deciding which health plan is best for you, one of the things that you could do is call the health plan's member services department and share with them what drugs you're particularly concerned about making sure you keep. The member services staff are trained and have access to formulary information, so they'll be able to tell you before you actually become enrolled, and as you're deciding to make a choice, whether or not your specific medications are covered through that plan.
Thank you, guys. Thank you, guys, and thank you, Eddie, for your information about the benefits. I'm sure we're going to have more questions. I'd like to remind you again on the call, if you're just joining us, anytime you want to ask a question, press *3. And tonight we're talking about Cal MediConnect, and we have representatives from all of the 5 health plans. And next we're going to talk about continuity of care, and I want to welcome Lisa Hayes, the Director of Senior and Disability Services for Molina Healthcare of California. Welcome, Lisa.
Thank you, Greg. It is such a privilege to be able to participate with this town hall. Thank you, all the guests who have joined us, the consumers and providers that have joined us to get this real valuable information. Really excited about the opportunity to talk about continuity of care. This is, I think, one of the best consumer protections that has been built into Cal MediConnect, into the Coordinated Care Initiative. Continuity of care, and this is a term we often refer to it as COC. It is not something that a lot of people know about, and there's a lot of controversy sometimes when folks say, well, if I can't keep my provider, I want to opt out. But before you make that decision to opt out of Cal MediConnect, and if you want to be able to take advantages of some of the great benefits that Eddie talked about, talk about continuity of care. So what it means is that you have the opportunity to continue seeing the provider, the primary care or specialist provider that you currently are seeing or you're currently using. There are some requirements under the continuity of care. If it's a Medicare doctor, you can receive continuity of care for 6 months. If it's a Medi-Cal doctor, you can receive continuity of care for 12 months. How you get access to continuity of care right now is real simple. You call the managed care plan. You'll call Molina, LA Care, HealthNet, CareFirst, CareMore, and request it. And you just say, I'm seeing Dr. So-and-so, I've been seeing him for a long time and I don't want to not have to see him anymore. The plan will reach out to that physician, and as long as that plan is willing to accept the same rate that he is currently receiving, he or she is currently getting, we will enter into a contractual arrangement with them so that you can continue seeing that provider. This is a really important, we really understand the importance of maintaining that relationship with your provider. And not only do we do this one-time agreement, but we're also going to talk to that provider about signing on long-term so that, hopefully they will agree to do that and so that you can continue to see that provider throughout the demonstration. So that's continuity of care in a nutshell. There's actually even some new things, new regulations that the state is developing that we will hopefully see very soon, where the provider, your actual physician, can call and request the continuity of care. So there's a lot of this is a great consumer protection for you, and it gives you the opportunity to try more coordinated care under the Cal MediConnect program.
Thank you, Lisa. I know opting out or trying to figure out what plan to choose based on their doctor being in the plan has been, that's all we hear about. It's one of the biggest questions that people get with Cal MediConnect. So thank you for that explanation, and we'll get to questions later. I'm sure we're going to get a lot. For those of you just joining us, we're talking about Cal MediConnect, and if you'd like to ask a question at any time, just press *3 on your telephone. And if you want more information about Cal MediConnect and you have access to a computer, you can go to calduals.org, and it's the state's website, and it has all the answers to most of the questions. Or you can call 800-824-0780. Again, that phone number, 800-824-0780. And they are the ones set up to answer all of your questions. Now we're going to take our second poll question, and that is, I would like my home care worker to participate on my care team. Press 1, yes. Press 2, no. Again, that question is, I would like my home care worker to participate on my care team. Press 1, yes. Press 2, no. All right, thank you for that. And Julie, are you ready for some more live questions?
Go with Knock. Hi, Knock. Knock, do you have a question?
Yeah, because you were saying about there were 3 options. The first one is do nothing, the second one is choose a plan, and the third one is opt out. Can you please explain that one again, please?
Dan, are you on the line?
I am, Greg. I'm still here. Yes, I'll be glad to explain it very, very briefly. Number 1 is do nothing, and you will be automatically assigned to a health plan that the state has identified as best matching your current doctor utilization. So if you do nothing, you will automatically be assigned to that health plan. The other option is you can fill out the choice form, or you can call Healthcare Options, and you say, I actually would rather join a different Cal MediConnect plan, or you have the option to join a PACE plan if you meet the requirements, and they will help you with that enrollment. The third option is you can choose to keep your Medicare the way it is today and keep it separate from Medi-Cal. But you would still need to do that. You would need to call Healthcare Options or fill out the choice form. And in that choice form, you would have to indicate that you would like to, you don't want the Cal MediConnect program, but you will need to select a Medi-Cal managed long-term services and supports plan. And again, Healthcare Options can assist you with that as well. And that way you'll end up with what you have today, You'll continue to do things on your own. You may not have the benefit of care management, but you'll keep your Medicare separate from your Medi-Cal.
Thank you, Dan. Julie, who's next?
Hi, David. Do you have a question?
I would like you manage to cause a permanency. Do I have to change it?
So you have Kaiser, and your question is to join Cal MediConnect.
Manage really cool. Do I have to change it?
Okay.
So are you asking, is Cal MediConnect part of LA Care and Kaiser?
Yes.
Do you want, Martha, would you like to take that? He has Kaiser, and he wants to know how that will be affected with Cal MediConnect.
LA Care.
And LA Care.
Maybe Gretchen should handle that.
Gretchen, will you answer that, please?
Oh, yeah. So you have Kaiser under LA Care right now for your Medi-Cal benefit. And so for your Medicare benefits, I'm trying to think of how that will work. I think that you can, I think that if you call into our member services number, they would be able to assist you with that and make sure that it works out for you. So you'd want to call this number, 888-522-1298.
Thank you, Gretchen.
You're welcome.
All right, Julie.
Okay, I'm going to go with Doris.
Hi, Doris. Do you have a
Hi.
question?
Yes, I just like the ones that are going to be, have been answering the phone and explaining the various plans. Give their first and last name, please. I don't know who Eddie was. I think someone said Marino.
Yes, hi. I'm Eddie Moreno, and I'm the Director of Community Outreach for Care First Health Plan.
Okay, that makes so much information. I just need to know who's talking about various plans, and that wasn't you didn't make that statement. At least I didn't hear it.
You know, that was my bad. I did a poor job introducing him. So we'll do better the next time. In fact, we're going to move on to our next presenter, and that would be Martha Santana-Chin from HealthNet. And Martha, we're going to ask her to briefly explain or talk to us about what care coordination is. Welcome to the call, Martha.
Thank you, Greg. And hi, everyone. Again, my name is Martha Santana-Chin. I am affiliated with HealthNet. And HealthNet is a large organization that is very happy to be participating with the Cal MediConnect program. We have decades of years of experience in serving the needs of people that have Medicare as well as people that have Medi-Cal. So this integration, or the coming together of the two benefits, we're very excited about and are honored to be able to serve the members who wish to enroll into Cal MediConnect. With regards to care coordination, Gretchen and a few of the other speakers talked a little bit already about the fact that really Cal MediConnect is intended to deliver simpler and more coordinated care. By creating a more organized system to help support the needs of people who are frail and elderly and have a significant amount of needs. And the goal is really to help people continue to live safely in their homes and their community. You also heard a lot about, you know, the fact that there is only one card, one telephone number to call, one plan to go to when you need to access any of all the benefits that Eddie already talked about. And one of the key features of Cal MediConnect, one of the things that we think is going to be very helpful to you, is the idea that the program is really intended to provide person-centered care. So what does that mean? Essentially, after enrollment, a person is then connected with a care manager. And that care manager basically is that person's advocate, that member's advocate. And they help to coordinate all of their needs. That care manager will also have a team of professionals to help them with that coordination. The team's going to be focused on meeting the individual needs of each member for things like medical care, services in the home, mental health or behavioral health services, and also social services and supports in the community. So what will happen is soon after members become enrolled and they become eligible for the program, the care manager will call them and ask them to complete a health risk assessment. That health risk assessment helps people or helps the care team and that care manager to better understand what that member needs and learn just more about that individual's perspective on their own health. So, for example, one member may be reporting that they live alone and that they're so frail that they really need assistance at home with maintaining their activities of daily living like bathing and dressing and cooking. While another member, through the health risk assessment process, we might find out that they really need help in connecting with a behavioral health or a mental health professional to help them through a difficult time in their own lives. Another member may have a different need. They may decide that they have a more immediate medical medical condition that requires attention. So that health risk assessment that the care team starts off with helps them to put together a plan that the member and his or her family or caregiver, if appropriate, agree is in the best interest of the member, and they execute on the plan. They help to carry things through. So that care manager and that care team, which we call an interdisciplinary care team, it's a mouthful, I know, but it's a care team. They basically wrap their arms around that member to help meet their needs by listening very actively and very effectively, and then coordinating all aspects of care. So that team helps the member to navigate the system. So they'll talk to their physicians, the pharmacists, specialists, durable medical equipment companies, and other providers to make sure that the member gets what they need, when they need it, where they need it. The other nice thing about this team is that since these are all professionals, they also look out for the well-being of the member in ways that each person alone cannot. So for example, they look to make sure that the specialists and the primary care doctors, for example, don't duplicate unnecessary tests and exams, because in some cases those are harmful if that happens. They also safeguard against making sure that the physicians are giving medications and treatments that contraindicate each other and could hurt the member. And they work very closely with the member, the family, and the caregivers to help them improve their overall health. And again, the goal is to keep people living safely and hopefully happily in their own community. So just a little bit about care coordination.
Thank you, Martha. I think that was a good taste of what care coordination is. We've got a few minutes left, and we've got some questions we'd like to take from the audience. Julie?
Good afternoon, and thank you for allowing me to ask my question. I wanted to find out what would be the difference. Say, for instance, I go to Rancho Los Amigos Hospital, and it's a rehabilitation hospital, and I have more than one physician for different things, like you have the urologist, you have your primary care physician. So how would that affect me once I choose a health plan?
Martha, you want to take that?
Sure, I'll take that. Happy to. So what will happen is that the care team that I mentioned earlier, and that care manager and that health risk assessment, and the information that you provide up front is going to help us to make sure that we maintain the relationships that are so important to your health. So Lisa earlier talked about continuity of care. So the nice thing about this program is that in your situation, there's many plans that you have to choose from. A number of them have relationships with the physicians and the hospitals that you see and that you're accustomed to working with. But in the event that you enroll with a health plan that say, for example, is contracted with Rancho Los Amigos and maybe one of your doctors, but the other ones are not, the health plan and that care team will work with you to allow for continuity of care to continue with the physicians that you have been seeing that may not necessarily be part of the plan. So that continuity of care protection that Lisa talked about earlier is really very important in cases like yours where you're seeing multiple physicians and are getting care at specialized treatment centers.
Thank you, Mark. I'm sorry.
If I could add on to that for a minute, Greg. The beauty of Cal MediConnect is the care coordination, as Martha was talking about. This is Lisa from Molina, by the way. That Jeffrey, your example is beautiful because that's exactly where Cal MediConnect can do its best, by coordinating all of the physicians that you see and coordinating to make sure they're maximizing the medical benefit for you. Just wanted to add that.
Thank you, Lisa. We're running short on time, but let's try to get one or two more questions in, Julie.
Hi, Nancy. Do you have a question?
Yes. First, I want to congratulate the phone call for clearly outlining that you have three choices: to be passively enrolled, to choose a Cal MediConnect plan, or to opt out. But I just received my 60-day choice form, and it didn't say it that clearly. It was very hard for me to figure out how to opt out. Now, in terms of continuity of care, I think the aspirations of care coordination are very laudable, but I'd like to see some evidence-based studies that these things are really occurring. And my biggest concern with continuity of care is if somebody's going through a critical regimen, like chemotherapy or kidney dialysis or being treated for hepatitis C, and they're passively enrolled into a health plan, what can we do to make sure somebody doesn't miss a dose of their chemotherapy drug, they don't miss a treatment, and after the 6 months, with that person who goes to Rancho Los Amigos, then what do they do when the continuity of care provision expires?
Eddie, do you want to take that?
Sure. So those are great questions, Nancy, and I really also welcome you on the call. I think what we need to understand is we have those provisions in there for the beneficiaries, so they're aware of it. And it's very important, as Lisa stated, that you guys know that